So Chris, thanks for sitting down with us today at the Doctus project.
Oh, the organisation's changed significantly since 2006. We started off with, I think, 3 people in the office. We've now got just over 2,000 people employed nationally. So that's a pretty dramatic sort of increase over an 8-year period. In fact, what we thought was the brief has changed dramatically. So in the early days, we were funded to put 30 headspace centres on the ground. We're now expanding to 100. We've got a telehealth, telemedicine service, we've got an e-headspace service, so an online counselling service, we've got a school support, suicide prevention and post-prevention service in schools. So it has gone, it has more than exceeded my expectations, and I'm very passionate about this area, and I'm very passionate about systems and getting the systems to work for people. And so from that perspective, it has really evolved into a system, a national system of care that is the envy of the world. How do you build something this quickly? So if the organisation's growing by 30 to 40% per annum, how do you build the systems to support that quickly in a sort of systematic, structured way? And the answer is you don't. You just put them in place and then you make it up as you go along, and then you fix it. Because in lots of ways Headspace had not been done before. So I think the politics of mental health are quite challenging as well. Often people say that it is a service sector that is starved of funds, and so people fight over the crumbs. But I think we don't help each other too well in terms of getting the job done. So the politics of health is complicated. The politics of state versus Commonwealth, territory as well, versus Commonwealth is challenging, because we're putting a Commonwealth program into state and territory systems. Getting the workforce is a real challenge. Getting doctors involved is a real challenge, and so there are multiple challenges, but it's really good fun thinking your way through it. There are changes to the mental health system that loom large. Frankly, I think what we did 20 years or so ago was deinstitutionalise, and we didn't really know what we were doing. We followed the American model, and what we know about America, and what we know about Australia as well, is that we left a whole lot of people homeless, and in fact they're either in mental ill people are either in homeless shelters or they're in prison. So we haven't done a great job, and so it does need another generation of change, and I often refer to Headspace as the next generation of change in the system, because it is very much a community-based service, which is important, but it is also about bringing together the various elements of service provision in the sector, because often what we do is we work not necessarily in competition with each other, but we don't work together to achieve the result for the patient. In a landscape of scarce resources, that's what we're going to have to do. And I know the Mental Health Commission recently has argued for better community programs and sort of said we don't need to invest any more funding in hospitals or beds, and I disagree with that proposition. I think that we do need to better orientate our community programs, and we do need to work in a way that really value adds to the patient. But actually there aren't enough beds in the system, and when you look at how the numbers have dropped over the last 20 years, and you look at the pressure on the system is broken, and it's not because of the people that work in it. The system is broken because there aren't enough resources in it. So I think we do need more direct investment in hospital beds. I think that would certainly ease the pressure in emergency departments and a whole range of other areas, and would certainly make the work of people who work in hospitals easier. You're not discharging people when they're acutely unwell. You actually get people to a stage where they're sort of better able to cope in the communities, and their families are better able to cope with them in the community. I think mental health is a very difficult area of medicine, and because people either get it or they don't. Actually, that's my sense, having spoken to GPs over the years. it's an area they're either interested in or they're not. And so when we talk about how we work with, how Headspace works with primary care, there are some people who, some GPs who don't necessarily want to see our patients in their clinics. But I think overwhelmingly there is a view in the community that we need to do more, and I think hospital administrators and other specialists, and I think ED physicians would be some of those who see this on a daily basis, who think, we've got to find a solution to this problem because we're getting, the system's backing up. So there's an appreciation for the issue and empathy for the patient, but there is a systems disconnect with all of that, and that's the bit we need to attend to. No, I don't meditate, and I've contemplated it, and I get bored thinking about it, and I get bored doing it, so I don't do it. The way I deal with my pressure, the pressure of my life, is to go to the gym every morning, and I used to do it after work. In fact, I'd go before and after work, and now I just do it because I'm getting old. I do it before work, so I get up at 5 o'clock every morning. I'm in the gym at 5:30. I leave at 7, and that helps me start my day. And if I don't start my day that way, I find I'm a lot less structured and a bit more disorganised, and so that's how I deal with and I tend to try and chill as much as I can on the weekends. But physical activity for me is the key to my mental health. The first thing I'd say is that there are lots of people, including your friends and family, who will support you. And it's really important to have a conversation with someone about this, particularly in the helping professions, actually, because we are terrible at helping each other. We don't identify as needing the help, and B, that when we ask for help, we don't actually do it. And I had a discussion recently with a Chief Justice of the County Court who said exactly the same thing when it comes to judges and lawyers, that they're not great at offering each other support, and I think it's very, it's much more salient in the health professions. I would say seek help early. I mean, because I've seen this in my own clinical practice, and I've certainly seen it at Headspace. The earlier you seek help, the less problematic things can become. And I think we know this in other areas of medicine, but the system's response in mental health is, let's wait till it gets to the latest possible stage, and then we'll intervene. If they're homicidal or suicidal, we'll offer them a service. Otherwise, they'll be fine. So we really wait for people to crash in the sector before we help them. And it's true, as in other areas of medicine, that the earlier you get help, the better, and you don't have a whole range of secondary problems that emerge, like substance abuse and family discord and homelessness and a whole range of other things. So. And it's true, talking to people that I've worked with in the past who are homeless, some of the older people have basically said that they had no support when they were struggling with some, very real issues, and so gradually things got worse. So early help seeking and talk to people.